Omicron continues to be a concern in Arkansas and around the nation as doctors learn more about this new COVID variant. Dr. Amanda Novak joins us live from Baptist Health as we continue our COVID-19 talks this afternoon. Dr. Novak, thank you so much for joining us. Anything new today we have learned about Omicron, and what is the latest that we do know?
So there's still a lot of questions out there, of course. One interesting thing we learned today is that samples from Europe that were gathered a week or two ago are positive for Omicron. So what that means is that this virus, this variant, has been spreading since before we even knew it existed. And so that's really been kind of the big news today. All over the world, different scientists are looking at the samples in those countries and seeing, could any of these be Omicron? And I think we're up to about 20 countries around the world that have found that in samples that have been gathered over the last week that they do have Omicron there. So far, all of those seem to be related to travelers, but it's probably just a matter of time before we start seeing this variant in people that haven't traveled anywhere and have just been exposed in the community.
Let's talk about vaccines or previous COVID infection. Could we see possible resistance to these?
Right, so there's some concern because this variant has so many mutations on the spike protein, which is what most of our vaccines and our immune systems target, that perhaps our antibodies or our other immune system parts won't catch it the way that we want it to, that it's not a perfect fit like the original vaccine would have been for the original virus that was going around. But what I would say is that even if it's not a perfect fit, it is certainly better than nothing. It is, it's like having a lap belt instead of a 5-point harness. It is clearly better to have some sort of protection than none at all. And there's not any proof yet that the vaccines won't work fine. There's reasons to believe that the vaccines might be totally adequate, and even if not perfect or ideal, that it's almost certainly better than not having any protection at all.
Do you see a possibility that if they find out it is vaccine resistant, we would see some kind of change to the vaccine in the future, or a booster? Do you see that possibly happening?
Right. I know that a lot of people are still nervous about the mRNA vaccines, but one of the most beautiful, elegant parts of the mRNA vaccines is that you really can switch them very quickly on a dime. Pfizer has come out and said, 100 days, we could have a vaccine that specifically targets this variant, like a glove fitting a hand. And so, 100 days is still a long time in a pandemic. That's a long time for people to get sick and hospitalized. But really, when you think about decades ago, how many years it would have taken to come up with a special vaccine like that, and to be able to come up with that in just a few months is really remarkable. So I really do have a lot of faith in modern medicine and science that we'll catch up with this, but it sure would be nice to prevent it to begin with.
Dr. Amanda Novak joining us live from Baptist Health. You are wonderful. Thank you again for joining us today.
Thank you.